Hi friends, I am Sarah.
And I am Ethan. Today, we are going to discuss about lung cancer.
So, shall we start, Ethan?
Oh yes, sure. So, what is lung cancer? Our body has a system of checks and balances for growth of cells. New cells are produced only when they are needed. Sometimes, the system of checks and balances on cell growth fails, and the outcome is uncontrolled growth of cells. That is known as a tumor. Lung cancer is a type of cancer that arises in your lungs. Lung cancer is the foremost cause of cancer deaths in whole world, including men and women. There are two types of tumors, as benign or malignant. Benign tumors are not dangerous to health, while malignant are dangerous to health. Tumor cells can spread to the other parts of the body by entering into the lymphatic system or blood vessels. Though lung cancer can spread to any part of the body, some parts, as adrenal glands, liver, brain, and bones are the most prone areas for lung cancer metastasis. So friends, what are the causes and risk factors for lung cancer? The major reason of lung cancer is smoking, for smokers, as well as for those people who are affected by second-hand smoke. Doctors believe that smoking causes lung cancer by damaging the cells that line the lungs. There are more than 4,000 chemical compounds in tobacco smoke. Many of them are to be cancer-causing or carcinogenic. There are such two main chemical compounds, as nitrosamines and polycyclic aromatic hydrocarbons. When cigarette smoke is inhaled, that is full of cancer-causing substances, like carcinogens. Changes in the lung tissue begin instantly. Initially, body is able to heal this damage, but as you smoke more, normal cells that line in lungs are gradually damaged. Over the time, due to more exposure of smoking, more damage happens, and huge damage causes the cells to act abnormally, and ultimately cancer may develop. Now Sarah will explain about types of lung cancer.
Sure, Ethan. Lung cancers are mostly classified into two types: small cell lung cancers and non-small cell lung cancers. This classification is based upon the microscopic appearance of the tumor cells themselves, precisely the size of the cells. There are different ways these cancers grow and spread. Doctor takes treatment decisions based on type of lung cancer. First one is small cell lung cancer, or SCLC. Small cell lung cancer happens in chain smokers and is less common than non-small cell lung cancer. SCLC metastasize quickly to many parts of the body, and mostly they are discovered after they have spread extensively. And the second one is non-small cell lung cancer. There are several types of cancer that behave in similar fashion. All these cancers falls under non-small cell lung cancer. Squamous cell carcinoma, adenocarcinoma, and large cell carcinoma falls under non-small cell lung cancers. Now friends, you are thinking about, what are the risk factors? There are a number of factors that may increase risk of lung cancer. Major risk factors are explained here. The first one is smoking. The major factor for increasing the lung cancer is smoking. You may quit smoking right now, and can lower the chances of having lung cancer in future. Second one is exposure to second-hand smoke. This is not a good news for the people who don't smoke at all, and are exposed to second-hand smoke, or passive smoking. So, if you're exposed to second-hand smoke, or passive smoking, there is a risk of lung cancer to you. Third one is exposure to radon gas. When uranium is naturally breakdown in rock, water or soil, radon gas is produced. This radon gas ultimately mixes in the air, and we are forced to breathe radon gas. There may be hazardous levels of radon gas in any house. Unsafe levels of radon gas can be determined by the radon testing kits, which are available at home improvement stores. If you find unsafe levels, you may apply remedies. Fourth one is exposure to asbestos fibers and other carcinogens. The workplace is a common source of exposure to asbestos fibers and other materials, as arsenic, chromium, and nickel, known to cause lung cancer. An asbestos non-smoker workers has a 5-fold greater risk of increasing lung cancer than non-smokers. In addition to that, an asbestos worker who smoke have a risk of 50 to 90-fold than a non-smoker's. Fifth one is family history of lung cancer. Individual genetic susceptibility may be a cause of lung cancer. People with family history of lung cancer, as a close relative with lung cancer, have an increased risk of the disease. Sixth one is lung diseases. Certain diseases of the lung, as chronic obstructive pulmonary disease, or COPD, is associated with an increased risk of lung cancer. Seventh one is history of lung cancer. If you have history of lung cancer, you are on a higher risk of developing a lung cancer than a person having no history of lung cancer. Next one is air pollution. Similar to passive smoking, exposure to highly polluted air can increase the risk of developing the lung cancer. Now Ethan will explain about symptoms and signs of lung cancer.
Thanks, Sarah. The growing cancer tissues may interfere with breathing. If this happens, patient may feel symptoms like wheezing, shortness of breath, cough, chest pain, and coughing up blood, or hemoptysis. Sometime, cancer may invade the nerves also. If that is the case, you may feel shoulder pain that travels down the outside of the arm. It is called Pancoast syndrome. Some patients may feel paralysis of the vocal cords that may lead to hoarseness. There may be invasion of the esophagus that may lead to difficulty in swallowing. If cancer has spread to the bones, it may produce severe pain at bone. If cancer has spread to the brain, it may lead a number of neurologic symptoms, such as blurred vision, headaches, seizures, or symptoms of stroke, such as weakness, or loss of sensation in parts of the body. There may be some other reasons, as weight loss, weakness, and fatigue. Some psychological symptoms may also be seen in patient, as depression and mood changes. Next topic is diagnosis of lung cancer. Doctors use a wide range of diagnostic procedures and tests to diagnose lung cancer. These include the following. Normally doctors ask about the history of patient and do some physical examinations to find out initial signs of lung cancer. Doctor may check the color of the skin. If it is bluish, it may be a lung cancer. The X-ray of chest is the very first diagnostic step taken by doctor to find out signs of lung cancer. X-rays may only expose the doubtful areas in the lungs, but it does not ensure whether the suspicious area are cancerous or non-cancerous. Some benign tumors or calcified nodules in the lungs may be recognized on a chest X-ray. Another one is CT scan. CT scan or computerized tomography scans may be performed to examine the lung tumors. This scan may be performed on the chest, abdomen, and brain. CT scans is more sensitive than X-rays to detect lung nodules, but CT scans are costly. Normally, an intravenous contrast material is given to the patient before scanning. This helps to outline the organs and their positions clearly. Next is magnetic resonance imaging or MRI scans. It may find out the precise location of tumor. MRI can produce a quite detailed image, and can also detect minute changes of structures within the body. People who have heart pacemakers, any metal transplants, artificial heart valves, and other surgically transplanted structures cannot be scanned with an MRI. This is because the powerful magnet of CT scan may move the metal chunks of these structures. Now, positron emission tomography or PET scanning. It is a special kind of imaging technique. Short-lived radioactive drugs are used in PET scanning to produce three-dimensional colored images of drugs in the tissues within the body. Anatomical structures are examined by CT scans and MRI scans, but metabolic activity and the function of tissues can be measured by PET scans. With the help of PET scans, we can determine whether a tumor tissue is growing. Moreover, type of cells with a particular tumor can also be determined. Bone scans are the next method in the row. Bone scans are used to generate images of bones to determine whether a lung cancer has metastasized to the bones. In case of bone scan, a small amount of radioactive material is injected into the bloodstream, and the same collects in the bones, especially in abnormal areas such as those involved by metastatic tumors. A scanner detects the radioactive material and records the image of the bones on a special film. Now, sputum cytology. In sputum cytology, sputum is diagnosed under a microscope. The tumor cells can be visualized with this method. Sputum cytology is inexpensive, and is a risk-free diagnostic procedure. But, drawback of this procedure is that, tumor cells will always not be in mucus. So, we cannot rely 100% on this procedure. Now, bronchoscopy. In bronchoscopy, a fiber optic probe is inserted through the nose or mouth to reveal the areas of tumor. A sample from these areas can be taken for diagnosis by a pathologist. Normally, this procedure is not comfortable, and anesthesia is required to perform this procedure. Bronchoscopy must be carried out by a lung specialist, who has well experience in bronchoscopy. Next is needle biopsy. Sometimes, lung tumor is peripherally positioned in the lung, and is not accessible by bronchoscopy. In this case, needle biopsy is used. With the help of a syringe, cancer cells are suctioned, and are examined under the microscope. Next is thoracentesis. Sometimes, there may be fluid between the lungs and chest wall that is called a pleural effusion. This happened because lung cancers involve the lining tissue of the lungs. With the help of a thin needle, that is called thoracentesis, a sample of this fluid is collected, and sent for diagnosis of cancer cells. Now next is major surgical procedures. If previous methods failed to obtain tumor tissues for diagnosis, surgical methods must be employed. Another one is blood tests. Though lung cancer may not be diagnosed certainly by a routine blood tests, but biochemical or metabolic abnormalities in the body may be ensured with blood tests. Biochemical or metabolic abnormalities in the body may accompany cancer. Last but not the least is genetic testing. There may be some genetic mutations in the tumor. To check out the same, molecular genetic testing is carried out. There may be mutations or abnormalities in the epithelial growth factor receptor EGFR. The testing may be carried out to check the same. Sarah, will you explain about treatment and prevention of lung cancer to our viewers?
My pleasure, Ethan. Treatment for lung cancer. First one is surgery. If cancer is at initial stage, as stage 1 or sometimes stage 2, surgery is commonly administered. In another case, if the cancer has not spread beyond the lung, surgery may be applied. Surgeons may remove a portion of lung, lobe, or sometimes the whole lung. Next is radiation therapy. In radiation therapy, high-energy radiation is directed to kill cancer cells. Radiation therapy may be delivered, either with the help of a machine that directs radiation toward the cancer, or internally by placing a radioactive matter in sealed containers at the location of tumor. Next is chemotherapy. In chemotherapy, drugs are administered to stop the growth of cancer cells. Drugs can do this by killing cancer cells, or preventing them from dividing. Sometimes chemotherapy is applied alone, and sometimes, as an adjunct to surgical therapy. It may also be applied in combination with radiotherapy. Side effects of chemotherapy are fatigue, weight loss, hair loss, nausea, vomiting, diarrhea, and mouth sores. Next is targeted drug therapy. There are newer cancer treatments as targeted therapies that work by targeting specific abnormalities in cancer cells. Targeted therapy is generally used in combination with chemotherapy. Trastuzumab, or Herceptin. There is a protein, called human epidermal growth factor receptor 2 positive, or in short HER2 positive, which promotes the growth of cancer cells. Herceptin targets this protein, and by doing so, it reduces the growth of tumor. There may be some side effects, as headaches, and heart damage. Lapatinib, or Ticerb. Sometimes, Herceptin does not suit to some patients. In that case, Ticerb is used to target the HER2 protein. There may be some side effects, as painful hands, painful feet, skin rashes, mouth sores, extreme tiredness, diarrhea, vomiting, and nausea. Bevacizumab, or Avastin. Tumor get the nutrients and oxygen from blood vessels. If the contact between tumor and blood vessel is terminated, the tumor will not get nutrient and oxygen. It will cause tumor to starve. There may be some side effects, as congestive heart failure, hypertension or high blood pressure, kidney damage, heart damage, blood clots, headaches, mouth sores. Now, I will discuss about prevention of lung cancer. The very first one is not to smoke. If you've not started smoking till now, don't start in future also. If you smoke, quit smoking right now. Risk of developing of lung cancer can be reduced by not smoking, even if you've smoked for years. Next is, avoid passive smoking, or second-hand smoke. Try to stay away from smokers, as well as such areas where people smoke, as bars and restaurants. Next is, exercise regularly. Start a routine exercise, at least for a couple of days in a week. Another one is, eat a healthy diet. Eat a healthy diet with various fruits and vegetables. Take vitamins and minerals from vegetable and fruits, rather than pills. Some other reason prevention as, test radon gas. Check the radon gases levels in your home. At least have information of presence of radon gas in your city. And last one is, avoid carcinogens at work. Have information about your work area. There should be no carcinogens. If carcinogens are available, always use safety equipment. If you are a smoker, there is a higher chances of getting infected by lung cancer. Thanks viewers for watching this video. If you like this video, please share with your friends.
If you have any query, please write down in comment box. You may subscribe this channel for more upcoming videos.